Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gwen Vaughn.
Welcome to the Auburn Group. I can't speak. Auburn Medical Group live stream. Yeah, you're tall again. Yeah, I think the camera just kind of over time gets.
Our camera person's falling asleep slowly.
Welcome to the program. I am Dr. Mark Vaughn. This is Dr. Gwen Vaughn.
That's me.
And we're talking about mechanical low back pain, which probably sounds kind of weird. Why that word mechanical is put in front of low back pain. But before we get to that, we will get to the comments, your comments and questions, specifically people like Robert Antonio, who asked, what makes low back pain mechanical?
That is a great question.
Is that a nod to the cause of the pain?
Yeah.
Okay, we'll get to that. And Bianca,
great question.
From the UK is saying hello. Hello, Bianca. We're glad to have you join us so late there where you live. Because it's 4:30 in the afternoon here.
Closer to you a little here.
Oh, thank you.
half out of screen there.
So, what about Robert Antonio's question about
mechanical low back pain? Great question. So mechanical, yes, refers to the cause of the lower back pain, that it is not neurologic or traumatic.
Yeah.
That there are lots of things that can cause lower back pain, but when we talk about mechanical, typically it's
not cancer, it's not infection.
The mechanism that moves the lower back, so muscles and surrounding the back, the muscles surrounding it. So that's mechanical.
So quite often we're talking about a muscle spasm.
Often, like a strain, spasm. People who have degenerative disc disease just have kind of weaker backs, so the muscles around it will try to support the minimal instability. I'm not talking about instability, but not like something that's like going to fall apart. But your lower back will kind of seize up to try to help out with that. When it feels these micro changes in the spine that it doesn't like, it says, "Hey, we got to keep this spine in line," and it will seize up.
So some people may be under the impression that there's some kind of a practitioner out there who gets x-rays of backs and sees that it's out of alignment. And
that's not what I'm talking about when I say that. Sorry, maybe my words were a little free there. But that's not what I'm talking about. That you just need to go get in alignment and you'll feel better. Often it's some action that you did that your back did not like, that your muscles around it are just trying to stabilize and spasm. And
so I feel like the question still remains, though, some person out there getting x-rays of people's low backs and saying there's, what are the words they use? Subluxation. So
that is a hot word in the chiropractic community.
Oh, you're calling names now. So there is such thing
as... That's what we're talking about. Everybody knows.
There is such thing as subluxation.
There is. True subluxation is
But they are using the word to describe something. When we look at the x-ray, we look at it, we go, that's a normal back.
Yeah.
Or, you have some scoliosis, or maybe you have some degenerative joint disease. Right. But there's not something that we're realigning to correct low back pain.
And it's definitely not going to correct your acid reflux.
So whatever it is they're seeing, we don't know what they're looking at.
The research shows that chiropractic can be helpful when you have like an injury. When you hurt your lower back, it can be helpful in the early stages of that, but then it should be combined with physical therapy to help strengthen those muscles. That's really the only place that studies show chiropractic can be helpful.
Yeah, I also have seen that also to be true when I check for looking into evidence-based medicine.
Yep.
So we had some comments here. Boy, oh my goodness. You guys are really putting in the comments. Let's see if we can go through these here. Before we go any further, we have
Bianca.
Bad
back. Oh, sorry to hear that.
I know.
I'm guessing that means that you have frequent back issues, or maybe you had a previous surgery or something. Bad back can mean a lot of things.
And then I can't read the name. Can you read the name on that?
Hildebauer.
Hildebauer? Oh, yeah. I was told bad knee, flat feet, and blown ankle that I eventually will have back pain alignment issues.
Oh, if you are, so
this
the
is
knee
something
bone's
different.
connected to the,
Yeah.
Yeah, it is all connected. And if you are walking abnormally and have an abnormal gait and your back is overcompensating, yeah, you can get back issues as a result of that.
Okay, and so actually what was going on with Bianca, she had a microdiscectomy with failed low back there.
Oh, I'm sorry to hear that.
Yeah.
Yes, that is a bad back. Sorry.
Robert Antonio, what causes the back to seize up? Muscles decide
To not.
I'm sorry, I'm messing things up here. Muscles decide not to move anymore?
So it's not that they're not moving, it's that they're spasming. Then they're actually moving to their tightest position. So you can't
Do we have any?
move because like there are a lot of muscles utilized in rotation, lateral bending, forward and flexion and extension, backwards. Can we see?
I don't know if that
There's
shows
not a
up.
lot of muscles there.
Let me take the comment off just temporarily here. So, oops.
Oh,
What'd I do? I hit another.
you hit another one.
How do you undo them? How do you undo the comments? Hey, there we go. So
Do that.
this.
This is the back. So we've got spine.
We don't really have.
Not a lot of the muscles here. They show the spine.
So generally, mechanical low back pain is in the low back, the lumbar region, which goes from your waist to your butt.
Yep.
Is that a good way to put it?
Yeah.
And then,
That's a little
oops,
above the
drop,
waist.
drop.
You lost the spinal cord.
Lost the spinal cord that was.
Good thing he doesn't have legs because now he's
now here.
a paraplegic.
So
There's your spinal cord.
this is. Can't really get much closer. It'll be out of focus if I do that. That's too small. So you have these bones. You have the main part of the body of the spine, and then some bones behind it that are for attachment of muscles and to protect the spinal canal that the spinal cord goes through in the middle. I'm sorry. I know.
There's
Seriously,
a lot
if I
of
put it closer, it wouldn't look any better.
Yeah, there's a lot of muscles involved in the lower back. From your thoracic spine all the way down to your sacrum. Your spine is the only bones there, right? So there's nothing else bony in your abdomen. It's all muscles holding you up at that point. So there's a lot of muscles, and because we are
A lot. Big muscles.
upright beings, a lot of muscles need to be back there to hold us up. So we're not, constantly.
Interesting point. I think when we're on this topic, and we do need to get to your comments and questions. I recognize they're there, but give me a moment. So this whole thing of upright, there's not a lot of upright walking quadrupeds. I guess you want to be a quadruped, you'd be bipedal at that point. There's not a lot of them.
Right.
There's humans.
Even monkeys kind of hunch over.
Usually,
and gorillas.
Usually,
and all
it's
of
not like a full time.
Straight up.
I'm on just the hind legs, sort of thing.
Right.
Bears will
do that
I've
occasionally.
even seen on YouTube cats and dogs walking around on just two legs. But for the most part, humans are one of the few species that do that. And when we look at the spine, we see these curves that the other primates don't quite have the same.
Right.
And humans, we've got a lot of this over the lifetime. They have problems with the low back. And it looks to be consistent with this hasn't totally
the human condition.
This is still like a beta version of an upright
Optimized
bipedal species that it's we've only been upright for how many thousands of years out of how many
tens of thousands
hundreds
of years
of thousands
versus,
of development. And so this is actually still a relatively new feature in the model that we currently have out on the market. and
without an update coming anytime soon.
And how long are we going to be dealing with this?
Sure. Yeah. So because of that, a pretty substantial percentage of the population has back problems at some point in their life. I bet if we polled our audience, a lot of them would raise their hand.
We know
probably
that.
Most of them.
I think we put those stats
Did we put that
the
in there?
description of today's show.
Yeah. So more than half, typically, depending on what study you look at, more than half of people will experience this at some point in their life.
Yeah.
And sometimes,
at any given time.
Yeah, and sometimes it can be severe, like to the point where you cannot move because your back will not let you.
Yeah.
And you know, I've had patients come in. I'm sure you are. They're like, I couldn't get off the ground. You know.
They don't want to come into the office.
Right. Yeah. Just coming into the office is painful.
Hey, there's
it's good to check on those
nothing
things,
we can do for you while you're at home either.
Yeah.
Bianca.
Visit.
I tried morphine, and even that didn't. No.
Oh my goodness.
Yeah, that's not.
No, that's
not a helpful thing in that situation.
Yeah.
Neuroforaminal. Okay, now we're getting into some interesting details that Hilda Bauer.
So that neuroforaminal narrowing is a little beyond that mechanical
that would be that
pain that we talk about. That's not talking about muscles. That's actually talking about the joints on the sides where the nerves come out that can get narrowed, and that can cause back pain, but it's a little different. That being said, that pain with the neuroforaminal narrowing can have waxing and waning, and some of that waxing can be due to mechanical type reasons.
And Z blaming it on having been a nurse, where that may be the
heavy
activity you were
people.
doing when you aggravated it.
Yeah.
That's actually a lot of lifting with poor body mechanics.
Yeah.
Not just in nursing, but in just life. We're always lifting things. Things are in an awkward place. You twist. You don't lift from the knee,
so
legs.
Twisting is a big offender for this sort of thing. You know, that action of twisting puts so much stress on the side of those side joints. Those what are the facet joints are called, and that can really aggravate a back. So when people are recovering from this, I tell my patients, work in a plane. For a while, you're not doing this.
That's right.
So tell your husband you can't do the dishes anymore or do the laundry.
That's right.
Sorry, you guys can't go play golf anymore. You know, it's somewhere you want to work in that plane for a while until your back kind of heals up. So.
Bianca's actually using a wheelchair because it hurts to get around.
Wow, that's pretty severe.
Yeah,
and if you had surgery, that's a little beyond what we're talking about is mechanical low back pain.
And then Angela Higginbotham had right hip replacement. Now my right leg is longer, about an entire inch.
Wow, that's significant.
Pain, yes, got to have that. That prosthetic shoe. I guess.
Try to
orthotic.
Because if you're walking and your pelvis is out of alignment and tilted, your spine is tilted with it, and it kind of has to correct, and can put a lot of stress on those side joints.
Bianca's got a numb thigh because of the
nerve involvement
on the sensory nerve there. Robert Antonio.
Yep.
Funny story. One time I was walking, I sneezed. That caused. Oh my goodness. I know that experience.
I've heard some. I've never had that experience, but I've had patients who have had that experience.
Not starting the spasm, but when it's already there.
Oh gosh.
Triggering it.
Yeah.
Sudden because you can't help but move when you sneeze. You can't.
Yeah.
Totally.
And you want so bad to not move your body. You try to brace for it. So.
I really can't do. Wash.
I would imagine.
Yeah, mop.
Mopping would be in that. Sweeping. Yep. All those rotational movements. What made you think of this?
I'm sitting pretty comfortably now.
You were really slow this morning.
Yeah.
I'm doing physically. Now. Mentally, he's fine, but physically, he was kind of slow getting in and out of his chair this morning.
Yeah, that was
going and seeing patients was.
Yeah, it's
a little comical watching you walk.
I'm glad.
You look like an old man.
Do I amuse you?
Hey, you absolutely did.
It's interesting how it's got ups and downs. I was able to walk 5 miles yesterday morning. It started out with a limp and walking much slower than normal, and toward the end just still feeling it, but still hurting.
Actually,
and so it gives us a little bit of we both have had this experience.
Yeah,
you have a little bit of sympathy for what the patients are going through, And you exercise the things like, no, opiate medications are not the thing that's going to help
that's
this
not
situation.
the treatment for this is not going to help anything to help it get better.
So there is some use of anti-inflammatories going on.
Definitely appropriate if you can to take Tylenol and ibuprofen.
And then also Tylenol with it because
augment that.
I was tired of hurting.
Sure. Yeah, and I'm sure that gave you a little bit of relief.
Not find a position of comfort.
Yeah.
Able to do anything.
So people probably want to know if you come into the office, in our office, because when you're going through this, it can be miserable. But we do have some guidelines and things that we look out for, because there are some conditions in the lower back that we do not want to miss.
Yeah.
You don't have any of those. We call these red flags. So if you come into our office, we're going to ask you some things if you have a lower back. First of all, we want to know your history. If you have a history of back problems, we want to know that. And it may be appropriate if you have significant injuries and worsening lower back pain with a previous injury or previous back issue to investigate that further.
Problems.
Right. If you have, so one of the things we ask is about neurologic changes. So if there's a progressive neurologic change, my left leg in a certain area is going numb and now it's getting weak, that's a problem. And that would be something we'd want to know about. And we ask you about those things: numbness, weakness. We want to know about urine function and bowel function.
Is there change there?
If there's change there, and that combined with numbness over the saddle area where your body comes in contact with a saddle when you're sitting on it, those two things can be indicative of a highly concerning emergency condition called Chiarotto A syndrome, where things need to get fixed fast or you can have some permanent damage. There typically when you come in, we kind of rule out the really scary things, but we also want to know some other things, because we want to know, but most people want to know, do I need an x-ray? Or they demand an x-ray.
We also missed, are you having a fever with it?
Yeah,
or
fever.
Do you have a history of cancer?
Fever, history. Well, yeah, I was going to bring those up because those would move us towards imaging more quickly to look at it, and moving more quickly to an MRI to look for infection, cancer. If you have taken a fair amount of steroids in your life for compression fracture, that can, older women who have a history of osteoporosis were more likely to image more quickly to look for a compression fracture. Those are kind of all the big reasons that we would get imaging early. But if you come in, you're otherwise pretty healthy, or have some non-back health conditions, but nothing with your back, and you're having pain, and you don't have any of those conditions, it will typically get better. I think it's
make sure our audience doesn't expect an MRI if they don't.
Don't come in expecting an MRI, because
so if you don't have any of those things, if you're like me, MRI is not going to make it better.
So we will treat the pain with ibuprofen, Tylenol as appropriate, and maybe even get you into some early physical therapy to have you start doing some gentle exercises to get you moving, because that's important. And then
without aggravating it.
And then prescribe the hardest thing to prescribe: time. Because these things take time, and the vast majority of these will be gone by 3 to 4 weeks. If it progresses on beyond 4 weeks, then that is an indication to move on to imaging. We do know that waiting that, if you don't have any of those red flags, waiting that 4 weeks is not going to change or make anything irreparable or have any damage beyond what we find. So that is something to...
It can take longer, though.
It can. So these things can take longer, but 4 weeks sometimes is like that is the cutoff where they say don't get an x-ray if there's no red flags before 4 weeks. That's the big thing. But yes, it can take longer. We should, if you are getting better at 4 weeks, you are seeing a noticeable improvement every day, and kind of headed, then that's all expected, and kind of you should be continuing that. Physical therapy may be appropriate.
Want to do some comments?
Absolutely.
Yeah. See,
I'm sure I brought it up.
Yes, I had this as well. Over a year with PT, the neurologist said it would take a year.
What takes a year?
To get better.
Oh.
And then Robert Antonio, is there any prevention?
Oh, great question. Yeah.
That'd be better than
than going through
it, wouldn't it?
So the biggest thing is making sure your back is strong. So doing gentle stretching and strengthening exercise for the back. The biggest thing is good lifting form for that. So if you're doing gentle weights or squats or something like that, make sure your body's in alignment. If you are lifting something, don't do that rotational lifting. That is really bad. Stretching, good ones. There's not a lot you need to do, but the cat and cow exercises, or if you're a yoga person.
Did you just say the cat and cow
That's
exercises?
what I said, yeah.
What are the cat and cow exercises?
So it's when you get on all fours, and if you arch your back and put your head down, you look like an angry cat, right? So angry cat, and then opposite, head up, belly down, pregnant cow. Angry cat, pregnant cow exercises. Now,
or as some of you may know them, the cobra and the child pose.
Yeah, I was going to say, if you're a yoga person, then cobra or chaturanga and child's pose.
I still don't get the cow. I don't get that one. I've never seen a cow.
It's kind of like your cobra.
I see the cat do that when it stretches.
Put its belly down. I always see an angry cat with it the other way.
Yeah, angry cat is arched up. And then the stretch is okay.
Yeah.
Continue.
So exercises, gentle strengthening, if you have something really heavy, getting some help, using proper body posture. If you have other things that are making you walk funny, then like that 1 inch difference in your that fixed. Get a lift on that one side where it's 1 inch shorter. Those are all things.
Where'd we leave off here? Proper body. Yeah, you were talking about body mechanics. I put his comment up that matched right at that moment.
Yeah. Absolutely. Yahtzee got that one. Yeah.
Yeah, and Yahtzee also saying, Bianca, muscle relaxer, extra strength Tylenol help me in gentle yoga.
Yeah, got to be a little careful with those muscle relaxers.
Muscle relaxers, we're not as... Yeah, we're not as much in favor of those.
Especially in those
they have a lot of side effects
who are older, over age 65. Yeah. Most of them have an anticholinergic effect that can interact with other medications and make you loopy, make you drowsy. You don't want to operate machinery, drive a car when you're doing those.
In hot weather, it can actually
make that worse. Yeah,
have problems with the cooling mechanism, especially in our older adults.
Right,
they're not able to sweat as well, and
if you're using a heating pad on your lower back because your muscles are tight, that's going to make that work. There are multiple reasons why muscle relaxers are not always the best. I mean, in young, otherwise healthy people, possibly, but you use with caution for sure.
Yeah. Bianca's looking for the magic pill.
I wish there was one, but it's not out there.
The goal is not to have complete pain relief, although we'd like you to not hurt too bad.
Yep.
But to make you as functional as possible. And hopefully we can do that through a combination of anti-inflammatory, if your kidneys will allow, and stomach.
Yep.
Have to consider cardiac risk with that now too, I guess. And then the Tylenol, again, if your liver will allow.
Yeah. Those are
Bianca, I have new symptoms in all those areas. Need to go back to my doctor. Gabapentin, amitriptyline didn't help.
Yeah, so those
have a place too.
Options when there's nerve involvement.
Not first-line medicines.
But when it's more of that musculoskeletal pain we're talking about, that's not typically first line. We're not going to hand that out typically, or it's not going to be appropriate. It's not that we can hand it.
And Bianca makes a good point here. If I could move to exercise, I would, but I can't. Exercise. No, you can't exercise when.
Yeah,
when you're
it does require
seized
movement.
Up. It's something that comes
that you want to do before or once you're able to start moving a little again with this sort of thing. Core strengthening, yes, I didn't mention that, but thank you for bringing that up, Yahtzee. Yeah. Absolutely.
Prevention.
Because like I said, the only bones between your ribs and your pelvis is your back. So everything around there,
let's strengthen that up.
Needs to be strengthened to give you some strength in that area.
Yeah. Then
pregabalin, which is Lyrica, that's similar to gabapentin, not really recommended in mechanical lower back.
Yeah, it's more for when it's nerve or chronic pain. Yeah. And hopefully we're not talking about chronic pain here if we're just talking about
sorry, we should have probably differentiated that
thing.
This is like acute.
You did talk about some nerve symptoms, the weakness and the
which would be something we'd want to know about.
There could be some radiating nerve pain in those people who
Yeah, and some people can get sciatica from this. Most people probably heard about that, pain radiating down the leg. If it is just pain and not accompanied by weakness or big sensation changes, that can be part of the lower back mechanical pain syndrome.
Yeah, those nerve pains like that, pregabalin, gabapentin. We prefer gabapentin because it's not a controlled substance in California. Yahtzee. I get that. Don't want to be drowsy. However, when it's horrible, it helps. Also,
meloxicam. So another
that's an
anti-inflammatory.
anti-inflammatory. That's what we're talking about when we say anti-inflammatory.
Yep. That's one that's a little stronger by prescription only.
Meditation and
I like
breathing.
meloxicam.
Yes,
Great
we don't want
medication.
people to stop breathing.
Breathing helps. Getting oxygen.
I am all in favor of meditation and
Keep breathing.
You
Yes.
find that they're helping out with it.
Yeah.
Certainly safer than any of the medicines that we prescribe.
Yeah. And formal physical therapy. Early formal physical therapy, getting you in with a therapist can be very, very helpful. So, all that said,
Yahtzee loves you too.
two. Us too.
Okay.
Not TOO. You too. I love you too.
Oh,
TOO.
both of us. I get it. Not the one in the middle. Got it. All right.
That's not a part of the love.
So
not feeling
and
love.
then Hilda breathing the right way. Okay. So
Yeah, I guess.
so using the abdominal muscles to strengthen them.
Yeah, that can be helpful.
Robert Antonio's thinking.
So,
That was
what's
good.
your plan for your back?
Well, when it hurts as badly as it did this morning, a combination of anti-inflammatory and Tylenol.
I should interrupt to say we were actually planning on this episode being me at the desk and him on the floor.
That's
we were actually.
That's what we were anticipating.
We had a contingency plan there, so
Yes,
so
actually,
he has some significant pain.
We did make
with certain
modifications
movements.
to my desk in the office that
Yeah.
we normally
Yep.
didn't because
Your standing desk.
I did ask a
Standing is
patient not to talk about other people's problems when he
It's
was
just-
telling a story about some relatives.
Oh yeah.
Please, let's stick to it. I'm not in the mood today.
I just need to get through this. Yeah.
Yeah. That was I started sweating at one point.
Oh my goodness.
Yeah.
Yeah.
But better now, and it is. It's
Yeah, it does that. So typically it will have kind of waxing and waning nature. Will kind of go up and down, but you should see slow and steady improvement. From two.
And with
what is that? 3
activity,
steps forward, 2 steps back.
you get a little loosened up. Actually, gets
Can be helpful.
better. I hate to tell people to walk through the pain or work through the pain because that's not always good
not
advice.
always smart.
But there is something about when you're stiff and you've
Getting moving
been
helps.
in bed or laying down or sitting in one position. You're stiff when you start. It takes a while to work it through. What do you know? Wow, I was able to walk a couple miles when I wasn't so sure at first.
Yeah.
And
Yeah.
it was much better at the end.
Yep.
Thank you, Dr. Gwaine.
Mm-hmm.
You are a
So
wealth of knowledge.
when a fair amount of you get that lower back pain, because as we said, more than half of you will at some point in your life.
12% at any time.
Refer back to this video and we will
Yes.
walk you through it.
Yeah.
And know that Dr. Mark is going through
Again,
what you're going through right
been
now.
through it
and
before,
commiserating.
doing it again.
Yep.
Yeah. Don't have a strong back and can aggravate
Yeah,
it
I know.
with
That's
overdoing it.
It's one of those things when you're not having back pain, you don't think about it, so you're not doing all those exercises. And then you get the back pain,
Yeah.
you're like, oh,
Kinda like
you
the shoulder
do,
people.
and you do it for like a month or two, and then it's better, and then you forget about it. I'm in that forgot about it phase, but this kind of reminds me that I need to do some back exercises. So all of you, do some back exercises, strengthen up your back. That'd be good.
Yeah. And then Hilda Bauer also saying thank you for sharing. Thank you for watching the show. I do want to mention you can be like Lindsay Antwine and get special mention on the show or other. I guess the other benefits are just knowing you're being a part of the show. Oh yeah, we put some people's names at the end. So
Yeah, you're helping put out
That's available through Patreon. If you're-
evidence-based medical
There you go.
recommendations.
So thank you for being here. Thank you, Dr. Gwaine.
My pleasure.
Until next time,
Hey, I'm Dr. Wade Vaughn.
and Dr. Mark Vaughn telling you to stay in good health. That was a good show.
Hey, all right. Pretty good. I like it.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.